So today, I want to address a commonly asked question regarding the need for MRI before coming for the Hifu procedure. Now, Hifu, or high intensity focused ultrasound, as we know, is an ablative technology for treating of fibroids using high energy generated from an ultrasound transducer. Now, for us to precisely do this treatment, we need to know the exact location of the fibroids, the number of the fibroids within the uterus, the level of blood supply that is going to the different number of fibroids within the uterus. And now this is only able to be determined using an MRI. So the MRI is able to tell us precisely how many number of fibroids the uterus has. Are these fibroids on the outside, on the inside, or within the muscle of the fibroid? Secondly, an MRI is able to tell us the precise location of the fibroids. For example, we know the uterus has several walls. That is the front wall, it has the back wall, it also has the sides, and fibroids could grow anywhere on the uterus. And therefore, the MRI is able to tell us, is this fibroid on the front wall towards the left or towards the right? Because when we subject this fibroid to the ultrasound energy, we want this energy to only land within the fibroid and not anywhere else for purposes of safety. So, correct location is of importance, and MRI gives us this. Now, thirdly, and actually very important, is what level of blood supply do these fibroids have? Is it high blood supply, moderate blood supply, or very low blood supply? Now, low and moderate blood supply fibroids are relatively easy to treat using Hifu, and majority of the times require just one session of the Hifu ablation procedure. Now, highly vascular fibroids, or fibroids that have a lot of blood supply going to them, can be slightly difficult or technically difficult to treat as compared to low blood supply kind of fibroids. The only way to determine this is using a pelvic MRI, which also has something called contrast, which is basically an agent that is injected so that we can be able to see how much of this blood is going to the fibroids. Now, another important element of the MRI is able to tell us, do these fibroids have any changes that might suggest a cancerous transformation or not? Because we know fibroids generally are non-cancerous growths. We call them benign, which is to mean non-cancerous. But in rare occasions, you can have a cancerous transformation of these fibroids into what is called sarcomas, or basically leiomyosarcomas, which is a cancerous transformation of the fibroids to a non-benign state. Now MRI is able to tell us the differences or the changes in these fibroids that can tell us that whether these fibroids have actually undergone this transformation or not. Because if the fibroids have undergone this cancerous transformation, then these are not very good candidates for Hifu ablation. Maybe you might require different kind of treatment. For example, it might require surgery or radiation, or basically a different approach to treatment. And therefore, in simple terms, the MRI is a preliminary stage before treatment to determine suitability, safety, and the level of technical difficulty or ease before we conduct the Hifu procedure. I hope that helps.